sleep apnea. Now, you may have already pieced together some of the parts of the definition of what apnea is from the prior videos that you've watched. You've probably heard me say things like 10 seconds long and 90% collapse of the airway. So let me give you a clear-cut definition. Obstructive sleep apnea is a reduction in airflow. That means the air coming in or out of your airway of at least 90% for a minimum of 10 seconds. So it's length of time and the amount of airflow that we're getting in or out. A hypopnea, which is a partial apnea, hypoapnea. Hypopnea is actually a 30% reduction, so you're getting more airflow for the same 10-second timeline, but the problem is during a hypopnea, your oxygen will drop at least 4%. So it's a combination of the length of time, which is 10 seconds for both events, coupled with the reduction in airflow coming in and out of your airway, and in the hypopnea's case, the oxygen dropping. Now, we do know that in a full obstructive sleep apnea event, the oxygen will drop too, but what we're really looking at is how to classify these events and what do they mean. So let's get into that. What do they mean? When your body is trying to breathe but can't for that 10 seconds, if you've gone through these exercises with us, you know how that feels in your body. If you haven't, take a second and go back for some of those breathing exercises and check them out. But as we understand what our body's going through during an apnea episode, we know that our body is not in a peaceful, calm state. It's in a crisis or traumatized state. And we know that in order to get out of an apneic episode, we have to wake up out of our sleep state. So our body's going to use muscles that are normally otherwise asleep to strengthen and open up our airway, and that stops the apnea or hypoapnea episode. So those two types of events combined, full apnea and partial apnea, in a sleep study, we're going to add those two events together and then divide them by the number of hours that we've slept. That gives us our apnea-hypopnea index, or what a doctor probably talked to you as AHI. Index just means that number of events per hour in the sleep test. So if your doctor had a conversation with you about apnea and they said that your AHI was 27, that means that 27 times per hour while you were asleep, your airway collapsed, either partially or fully. You were choking for at least 10 seconds or longer while your oxygen was dropping, and then your body had to wake up out of its sleep state to use muscles in the throat to open the airway and then restart your breathing again. Now that sounds pretty traumatic, and frankly, it is. It's not normal to choke. It's not normal to go without oxygen, and it certainly isn't normal to wake up 27 times an hour. Now, I know what you might be thinking. Waking up 27 times an hour is impossible. Nobody in their right mind would do that, and they wouldn't survive if they did. Well, I get what you're saying, but what we're talking about is something slightly different. You see, when you think about waking up, I'm guessing you're thinking about getting up out of bed to use the restroom or possibly get a drink of water. That's completely different than the type of waking up we're talking about here. Waking up as it relates to sleep apnea and what the body has to do to restart its breathing is a simple break in the sleep pattern. We know that there's different stages in sleep and different depths. It's breaking that sleep pattern to come back up to being awake. And when we do that, it can cause fatigue over time in our bodies because our body wants to stay asleep. So as we go throughout those sleep stages throughout the night, normally, and with apnea, we're breaking back up into wakefulness, it can cause fatigue to happen. So that 27 times an hour, often for most people, isn't even memorable, meaning they don't remember waking up 27 times an hour. They might feel like they woke up a couple times throughout the night. So sleep apnea by itself can be very deceiving since it happens at night while we're sleeping, and even the waking up part of sleep apnea isn't something we're normally aware of. So it makes sense that when your doctor says 27 times an hour or 15 or whatever your number is, that it seems a little bit confusing, but I hope that adds some light to it.